Welcome to the webinar. You have entered as an attendee in listen-only mode.
Out in terms of from its passage to what we've done so far to implement it. So 2403 was introduced in last session, and it's called the Down Syndrome Resources for Parents Act. It was first introduced by Representative Linda Kochmar from Federal Way, and as you can see from the slide, it passed quite easily through both the House and the Senate. Governor Inslee signed it on March 29th without any change. Of course, the governor always has the power to veto line items, et cetera, but he made no changes, and the law became effective on June 9th. Sort of the downside to the bill was that it did not include Department of Health shall. I've put quotations around the word shall. It's sort of a big deal in the legislative language because it's basically what you absolutely will do. And that's develop resources regarding Down syndrome for any family, whether it's a prenatal or postnatal diagnosis. And it went on to say that these resources need to be written, up to date. They had to be vetted. They had to be reviewed by medical experts as well as national organizations. And it needed to include contact information for both national as well as local Down syndrome organizations, educational and support organizations, and programs for families. And lastly, that these materials needed to be culturally and linguistically appropriate. Now, this is where the no money comes in because, quite frankly, developing educational materials or health promotion, we print them and then we develop them in multiple languages. So to do that could cost well over $100,000. And remember, there were no resources attached with this bill. Next slide. The bill also said that these 7 individual healthcare professional types, midwives, nurses, osteopathic physicians, and osteopathic physician assistants, genetic counselors, physician assistants, physicians, as well as 2 different facility types, hospitals and birthing centers, needed to provide these materials to parents after a child was newly diagnosed or a developing baby was newly diagnosed. Again, prenatal or postnatal diagnosis. Next slide. So we had been tracking this particular bill with a great deal of enthusiasm all of last session, so we completely supported it. And early on started taking a look at what kinds of materials were already out there. We already knew that it was a really tight budget session because of the McCleary decision. For those of you who aren't familiar, it's the fully funding education. It's sort of been bogging down the state legislature for the last 3 years. So we had an inkling that this wasn't going to come with resources. So we were trying to figure out how can we implement at least the spirit, the intent of the law, even if we don't step back and actually develop our own materials. So we started taking a look at different materials that existed. We were well aware of the letter case materials, the Understanding of Down Syndrome Diagnosis. Really liked that one. We were looking for other materials as well. And then we began taking a look at, well, do we have any money? Because the Understanding of Down Syndrome Diagnosis is not free. It does cost some money. And so good or bad, we did have some staff turnover in 2016. So I was sort of scouring my budget. How much money could I scrounge up to purchase some of these? And we began having conversations with Stephanie, who you'll hear from later, about, well, how many could we realistically purchase? Could we get a discount? Could we get these in additional languages? And ultimately we did strike a deal, and we paid for this particular booklet to be translated in 2 additional languages, Vietnamese and I'm going to forget one other Asian language. Stephanie will probably remember. And then we also purchased 300 copies of the booklet. And thinking about roughly 120 diagnoses a year, that might last us roughly 3 years. So that was sort of our thinking behind how we began the implementation process. We also, we did not have a secretary senior at the time. We did have another genetic services specialist, Corey Snelson. So between Corey Snelson and myself, began contacting lots of different organizations, trying to pull together the information around local resources. So parent to parent, family voices, the Down syndrome organizations that we were aware of, and ask them who else should we be talking with. So that's sort of how we, I'll say, cobbled together our local resources information sheet. And one of the reasons that I'm very happy to have everybody on the call today is I would love, love, love for you to tell me who have we missed? Who else should be on this list? Because we'd like it to be as complete as possible. At the same time, we also began writing some news articles specifically for professional organization newsletters and compiling emails from the various professional organizations. Now, when I say professional organizations, I'm talking about, for example, the Midwives Association of Washington State, the Washington chapter of the American Academy of Pediatrics, the Washington chapter of the American Congress of Obstetricians and Gynecologists, the Washington Academy of Physician Assistants. So again, all of those professional organizations that represent those individual practitioners who are supposed to be disseminating the information. In addition, we had a listing of all of the hospitals, birthing hospitals, and a listing of all the birthing centers. And so we sent them all this sort of news article that they could put into their newsletter, as well as an email that we would hope that they would send to all of their members. We also contacted our own state Department of Health licensing groups. There's different individuals who sort of provide oversight to the various licensure practices, and we asked each of those to send out an email, same information, how do you access these resources, what does the law say, what is your responsibility, and those were emailed to all of the active licensed healthcare practitioners in our state. And then last but not least, we worked on updating our web page. If we could minimize the slides and go to the Department of Health webpage, I'd like to take just a moment to show you, if you are on our website, how you would actually find these materials. And I will be the first to say it's not ideal. We have a platform for our webpage in the Department of Health that's, to me, not the most user-friendly. So I'm going to first of all have you go up to the search box, the white search box in the right-hand corner, and type in Down syndrome. And what you will find is it will take you to, go ahead and hit the PDF, that will take you to the local resources page. So again, these are the parent family support organizations that we were able to identify, as well as an email or phone number. One question I have for you is, should we have an address? Do we have them all? And our plan for this is that every June and every December, we will go through all of these to make sure that they are still active and that they are still the appropriate links. And then again, my hope is that you all will give me further ideas of how to make sure it's complete. If you close that down, and you should go back to the web page. Well, no, I wanted it to be on the web page still, if that's possible. What I was going to show you is that it doesn't take you, is it possible to go back to the web page? The only way to get to the place where the booklet is shown is actually by searching for genetics in that white box. Again, this is the difference between, genetics. I've asked them, why is it they can't, when somebody goes to Down syndrome, it can't just take us to the web page. They haven't figured out how to do that yet. So here, if you type in genetics, you get to our genetic services homepage. You want to go ahead and click that on, and you'll see we've put up at the very top information for parents who have received a prenatal or postnatal diagnosis of Down syndrome. So if you scroll down just a little bit, you'll see that you can actually access this in multiple languages, and again, you can get to the link for the local resources page. So this is what I would have preferred people went to if they typed in Down syndrome. We haven't figured out how to do that yet with our platform at DOH. So it's not as easy as I'd like it to be for people to get there, but they can get here, and it is available in Korean, Chinese, Japanese, Vietnamese, Somali, Russian, and Spanish, as well as, of course, English. Okay, we can go back to the slides. So to date, not counting staff time, we've spent a little over $10,000 on implementing this particular legislation. We have been tracking how many hits we get to our website, how many copies of the mailing people have asked for, how many downloads of the local resources sheet. We have plans to send reminders to all of those professional organizations as well as hospital and birthing centers every 6 months. Now, we were going to do it in December, but that's when we started talking about this webinar or shortly thereafter. And so I'm sort of waiting to get additional ideas from you, but we are poised and ready to send reminders as early as next week. But again, I wanted to get feedback from you on what would be a good way to make sure the word gets out about this. And again, I'm really hopeful that we'll have a great brainstorming session and all of you will provide additional input on what we could do to make sure that all families get this information right after a diagnosis. I'm not going to give you any more details because I know both Stephanie and Jessica are, so I will go ahead and call it a day, and thank you again for joining us.
Thank you so much, Deb, for the background of the Department of Health's response to the legislation and for all of your work behind the scenes to make it all happen. And now I'm thrilled to introduce Stephanie Meredith, the Medical Outreach Director at the University of Kentucky's Human Development Institute. She is the author and co-author of multiple resources for new and expectant parents receiving a diagnosis of Down syndrome and other genetic conditions, including Understanding a Down Syndrome Diagnosis, as Deb mentioned, a main resource Washington State offers at this time. She offers medical outreach training to Down syndrome organizations nationwide and consults internationally on best practice strategies for developing and sharing information about genetic conditions for patients. The resources Stephanie provides are invaluable, and it is amazing to be able to hear from her today. She's been an incredible resource to Deb and I and has been so wonderful to learn from and work with. And we're so thankful for your participation in this webinar this morning, all the way from Kentucky. Welcome, Stephanie.
Oh, well, thank you so much for the kind introduction. And you all are also so lucky to have, Deb in the position she's in at the Department of Health and someone who really wants to stay up on this issue and continue to monitor it going forward after the law has been passed, because we work with a lot of different states and, in some states the law is passed and no one ever follows up years later. And so I was so excited to hear what the plan is to continue to update information every 6 months. And as Jessica mentioned, so we're actually part of the University Center for Excellence in Developmental Disabilities at the University of Kentucky. Each state has one, and they have different areas of expertise. And one of our areas is this National Center for Prenatal and Postnatal Resources. And it's an umbrella program that includes letter case. And if you want to go ahead and forward through those slides. The National Center for Prenatal and Postnatal Resources, which includes 3 different programs that had kind of been developed independently, and we combined them into one umbrella national center. And if you want to go to the next slide. So letter case specifically focuses on patients who are receiving expectant parents who are receiving a diagnosis and just need information at that moment of diagnosis. And we actually at this point cover Down syndrome, Turner syndrome, and we have developed resources now for Jacobson syndrome. Down syndrome pregnancy is geared more towards expectant parents who are preparing for the birth of their baby and need much more detailed information about breastfeeding, preparing siblings, preparing for possible NICU stay, those sorts of things. And then Brighter Tomorrows is targeted toward medical professionals, and it's got video tutorials and different best practice guidelines for medical professionals. At one point, it did have a family component, but that has actually been retired, and we now focus that particular program exclusively for medical professionals. Next slide. And so what our program as a whole focuses on is supporting new and expectant parents who are receiving a diagnosis. And we try to provide online resources as well as print. And as Deb mentioned, we make all of our online resources, we're not a pre-funded program at the university. So our program basically has to kind of pay for itself. But we also are very committed to providing public service, and we're a nonprofit program. So we make all of our resources available online for free, but then we do charge for the printed resources because there's obviously a lot of investment that goes into that as far as the printing costs, staff time, photography licensing, things like that. So we try to provide as much as we can for the community, but then we also need stakeholders like different departments of public health to be helping to continue to reinforce the program, because we do continuously update our materials, both for all of the programs that we have. So that's a priority for us, to make sure that everything stays up to date, accurate, and balanced information. Next slide, please. I think that just went backwards. The other thing that we do as part of our program is to build relationships with the medical community by providing them resources and presentations. So we give presentations for national medical conferences like the National Society for Genetic Counselors, American College of Medical Genetics and Genomics, and really trying to bridge those relationships on a national level between the patient advocacy community as well as the medical community. Because what we found, and what was the impetus for a lot of these laws, is that medical professionals have been doing a great job of providing all of the medical issues that might be associated with the condition, but might not be providing kind of the life outcomes and the psychosocial outcomes. And so our goal was to try to merge those two communities to help them to better share information with each other, because fundamentally what parents want to know when they find out that their child is going to have any kind of genetic condition is, what is life going to be like for this child? And so they want to have that information when making pregnancy decisions, and also when preparing for a possible birth of a child. Next slide, please. And then the other piece of what we do is supporting Down syndrome organizations by providing them with training on how to engage with their local medical communities. We have online resources for them, webinars. We go to national Down syndrome leadership conferences and give presentations on how to build those relationships at a grassroots level with the medical providers in their area, so that it's a mutually beneficial relationship. Next slide, please. And so this is where you would find our Lettercase resources to go directly to them, and that's at lettercase.org. And you can see that there are web apps that are available for Down syndrome and Turner syndrome. When you click on the web app link, that will take you to understandingdownsyndrome.org, and that's where you'll find the materials in Vietnamese, Somali. Then those were the two languages funded by Washington State. Then we also have the other range of languages that we discussed. There are 8 total, and we will be translating into French fairly soon. So that's what we offer there. Next slide, please. And you can also, medical providers also can request books directly from us at no charge, medical providers and patients. So that's why I also did an assessment when we were planning for this webinar, of how many direct requests I've been getting from Washington State, because you may have people who are requesting from the Department of Health, and then others who are requesting directly from us. So we track that data as well. And all of our materials that we provide are reviewed by, and this is our Understanding Prenatal Screening and Testing. We cover prior to testing and offer materials about that. Let's go on to the next one, because I don't want to spend too much time. I guess I thought there was another slide there, but just wanting to emphasize that all of our materials at the Lettercase website are very meticulously reviewed by leaders in the medical community. Typically, we have for those materials representatives from, now we've brought in the American Academy of Pediatrics, American College of Obstetricians and Gynecologists, as well as the National Society of Genetic Counselors and American College of Medical Genetics and Genomics. We have representatives from all of those organizations to review our materials, and we also have members of the advocacy groups and our Association of University Centers on Disability. So we try to get a really broad range of stakeholders to review the materials from the medical community and the advocacy community, so that we can provide a balanced balanced set of information for those families. Brighter Tomorrows, you would go to brighter-tomorrows.org, and that's got tutorials for CME credit for medical professionals about how to deliver a diagnosis. So that's another way to ensure that clinicians are getting the best possible, following best practice guidelines and delivering that information to families. Next slide, please. And these particular, the materials that we have at brighter-tomorrows.org are evidence-based and included in the American Journal of Obstetricians and Gynecologists, and also included in the National Genetics Guidelines. So it's a great way for professionals to have, best practice models on how to deliver that diagnosis. Next slide, please. And DownSyndromePregnancy.org is the last program that falls under our National Center, and that's specifically for families preparing for the birth of that baby. So they're no longer in that first diagnosis phase. It goes into a lot more detail about breastfeeding, siblings, all of that kind of information. Next slide. And we also have books that are available for free download at that website that you can access as well. And that includes our Diagnosis to Delivery book and Your Loved One is Having a Baby with Down Syndrome for Grandmas, Grandpas, Aunts, and Uncles as they're preparing. And everything's also available in Spanish there as well. Next slide, please. So to kind of give a national perspective on this, the motivation for these Down Syndrome Information Acts, what really motivated a lot of advocates to start getting involved in this were the Brian Scott Coe's 2005 research indicating that there were a large percentage of families who felt like they were not getting well-rounded, balanced information upon learning about a diagnosis. And then at the same time, you had the ACOG Practice Bulletin 77 and 88 saying that all women should be offered prenatal screening for aneuploidy in general, but that includes Down syndrome. And then you also had the Kennedy-Brownback legislation, which is now known as the Prenatally and Postnatally Diagnosed Awareness Act, which was passed in 2008, indicating that families that families should be provided with that range of information. Now, like Deb mentioned, there was no shall language in that piece of legislation. It was supposed to instead include the allocation of funding toward these efforts, but instead there was no appropriation that ever went toward it. So it was supposed to be $5 million a year for 5 years, but almost none of that was actually appropriated towards this purpose. And so for that reason, there's really been an absence of funding at a national level for these efforts. And so a lot of the states then have stepped in to provide that funding or just the more strict requirements in the language because it wasn't done at a national level. So that's where some of the motivation came from. The other was cfDNA testing launching in 2011 and the concern from the advocacy community that testing would would exponentially grow while at the same time there wasn't an infrastructure for education to provide families with information about the condition for which they were being tested. Next slide, please. Now, the concern then that arose among patient advocates with that proliferation in testing was that studies were indicating that 45% of obstetricians didn't feel that their training was sufficient to be providing that kind of information, and only 29% of medical professionals stated that they provided education material to their patients. Now, I think those numbers, this is almost 8-year-old information. I think so much of that has improved, but still, at the same time, this prenatal testing is including more and more conditions that are less common and less well-known. So it introduces additional concerns moving forward with adding more conditions to the panel for which there might not be support for education. And then also a survey of mothers receiving a prenatal or postnatal diagnosis were rating their experience as negative 2.5 times for every one positive experience. And in the testimony in Maryland in 2014, one mother testified, and this was her motivation for why she got involved in wanting this law passed. She said in 2006 that her child had, she was given a pamphlet that said, "So you're having a mongoloid, now what?" And that was in 2006. And she was saying how horrified she was by that presentation of information. And so they wanted to have more standardized information that was being provided to families. Because a lot of that just happens because, gosh, that's just the pamphlet that happens to be in the drawer that's available when someone has their baby and it's pulled out and it might be 5, 10 years old. All right, next slide, please. So currently we have a number of states that have Down Syndrome Information Acts. Virginia and Missouri actually had laws passed prior to 2012 that use some really different kinds of language. But now we have these additional states, 2012 through 2016, that have passed laws with pretty similar language as far as providing information that covers these life outcomes as well as medical issues, trying to provide accurate, balanced, up-to-date information. And you can kind of see the outline there. And so Washington's kind of following in that last bit of 2016. So, and what we try to do typically through our national center is we're not involved in any kind of lobbying or legislation, but we end up helping the departments of public health after some of these laws have been passed and kind of help guide them through that process and what we've seen from other states, what's been effective, what hasn't been effective, and trying to provide some insight about that. And you can find, if you want to go to our website, lettercase.org/state laws, we give links to the text for each of those laws and then also to the website where the departments of public health have implemented them. So then that way, because we provide a lot of support for genetic counselors, that way genetic counselors can find what's applicable in their states. Next slide, please. And there's that page, so you can see kind of what it looks like where it's got the state law and then the fact sheets associated with the law. Next page, please. All right, so what we found with the implementation of state laws that different states have done, some have done press releases, reaching out to the local and state media. Some have done allocation of funds for supplies to be maintained or distributed either by the Department of Public Health or the advocacy organizations. There are also email distributions through the Department of Public Health and state medical organizations. Department of Public Health letters or newsletters that are mailed directly to medical providers. If they have their own listserv of providers they reach out to. There's also usually the creation of a web page at a very minimum so that families and providers can find that information. Some states have done booths at medical conferences, local and state medical conferences, and others have engaged in presentations at hospitals through grand rounds, different kinds of outlets like that. Next slide, please. Great. So we're kind of in a unique position for some of these laws to see what the impact is, because for many of them, they require that the information include physical, developmental, educational, and psychosocial, life expectancy, all of that information listed there. And because we are the only resource to be included in the guidelines by ACOG, ACNG, and NSTC, our materials tend to fall into that category that meets the needs of the laws. Some states develop their own resources, but for many of them, our materials fulfill those requirements, and that's what they end up recommending. And so we're in a unique position to kind of evaluate what the effectiveness is. Next slide, please. So we did an assessment for a conference last year where we really looked at what how states were accessing our information and how they were saying they learned about it. And we also looked at what those states had done in the implementation of their laws to see what was actually working, what wasn't working. And what we found was that these laws were least likely to help clinicians share information with the following 4 factors. So one, there were some states that passed laws and they provided no information online or in print by the Department of Public Health. clearly that means there's not going to be an implementation of it. The other is when there's no funding allocated for print resources and there's only static information on the Department of Public Health website, because that's requiring clinicians and families to actually look on that Department of Public Health webpage, which they may or may not do. It helps when there's some kind of push model. And that doesn't mean necessarily having to provide a whole book, but it may be sending out a letter. It may be sending out, an email or a bookmark or something that has that kind of information on it. But there has to be some level of there being a push model. Also, when legislation sets limits on information, including reproductive rights, that also tends to cause issues in the dissemination of information about the law, because the medical community doesn't feel as invested in it when there are limitations in what they're allowed to share. And also, of course, when clinicians receive no notification about the law, when there's not a concerted effort to either do an email campaign or a press release, then you're not going to see a lot of uptake in people accessing resources. Next slide, please. But we found these Down Syndrome Information Acts to be most helpful when states do actually engage in those email distributions, and also go to medical conferences when they distribute print materials and have them available. And so we did a little assessment of how information was being accessed from Washington since the passage of your law. And our assessment was that, we looked at the 2015, which was the latest available data I could find for births in Washington. And based on that, there should have been about 111 births of babies with Down syndrome. And, there should be about 111 births per year. And so what we found were that there were 29 books requested by medical professionals in 2016 and in 2017. And I specifically did not look at data until after June, so after the law was passed, from 2016 to 2017. You had 47 of our books were requested by medical professionals. So on our end, we saw 62% growth in the request for free printed books since the law had passed. Now, that didn't include any of the books ordered by the Department of Public Health or advocacy groups. That was just based on medical professionals who self-identified as medical professionals who requested free books from us. In addition, we also had medical professionals who ordered 28 books from our Down syndrome pregnancy program in that time. So they may have had patients that they already knew needed more information. So there has definitely been growth in that area from what we have seen. Next slide, please. So separately, we have had patient advocacy groups order some more materials, and we've also had expectant parents who've directly asked for materials themselves. Those are some pretty small numbers, but definitely that's been happening in addition to the clinicians. Clinicians by far are the population requesting the most. And next slide. And then online access. We also tracked our online access of information from Washington State. And so from our Down syndrome pregnancy program, we saw growth from March 1st, 2015 to March 1st, 2016, 1,000, and I was looking at when the law was passed, I think, and not June, so kind of not as clear with that one. But we had a growth of 1,073 people looking at it to 1,349. And then the growth in letter case, you can see it went from, we actually tracked from 2015 to 2017. It grew from 199 to 234 to a big jump to 361. So you can see that growth was bigger than our normal growth we would anticipate from year to year. We actually had a 54% growth online since the law passed. And the National Society of Genetic Counselors Conference was held in Seattle. So definitely quite a bit of growth, especially when you compare that to the growth rate of the prior year being 18%. Next slide. So what we really found were that the majority of those medical professionals who were requesting materials, they were self-identifying as genetic counselors. We got very few who self-identified as obstetricians. So what I was seeing as needs in Washington State are definitely doing more outreach to OBGYNs and pediatricians, engaging in more outreach maybe at medical conference and presentations, and more outreach to rural areas, because most of the requests we were getting were from the more suburban, urban areas of Washington. Next slide. All right, well, I want to definitely turn the time over for Jessica, and I'm sorry I tried to go through as quickly as I could and also share that pertinent information. And I'm seeing some questions.
Yeah, it'd be great to go over this one question. Says, I have the booklet, Understanding a Down Syndrome Diagnosis. It's great. What is the reading level? Are there lower reading level materials available for families who may need them? Thank you for the question, by Emily Afulio.
Yeah, and that is actually a great question. So what we do is we actually take each sentence and assess the reading level. Ultimately, ultimately we have to aim for kind of a ninth grade reading level. Part of that is because, we try to do 8th to 9th. Part of that is because they're medical terms, and we try to actually lower the reading level by defining those medical terms. So if we say hypothyroidism, we try to say, define what that actually means. Mm-hmm. But ultimately, you're going to have an inherently higher reading level when you have words like genetic, hypothyroidism, Hirschsprung disease. Those things are going to raise it, but the rest of the text itself is, we try to keep it as low as possible. So, and try to ameliorate that with the, by defining the medical terms that are in there. Now, that being said, we actually are working on an update, and that is going to be an even lower reading level, and that should be available actually in the next week or two. So you're kind of the first to be hearing that.
Wonderful. Thank you so much, Stephanie, for all that you do and for your national perspective. It's really just so helpful to hear the background on your programs and what has worked in other states, so we can learn from one another in this work. Thank you.
Thank you so much for having me.
And now to our audience, we would love to see if you could answer this question. Do you know how to access the resources that were passed with the Down Syndrome Information Act in Washington State? And maybe this presentation has helped you to access some of these resources. So if you could take just a moment to vote on that, that would be great. And as people are finishing their poll questions, I'll just continue on my portion. Again, I'm the Down Syndrome Outreach Coordinator for the ARC of Whatcom County. But firstly, I'm a sibling of an 18-year-old with Down syndrome and a friend to many and an active community member. And I think it's so wonderful that through this webinar, we can represent families, self-advocates, community members, healthcare workers, the Department of Health, and our state legislation. There are so many aspects to this work, and we ask you to remember each other's perspectives as we move forward in this webinar and beyond. And please continue to take notes and add comments to the question box. I'm going to go as quickly as I can through my information, but we'll have time to brainstorm and discuss things at the end. Next slide, please. As we continue to work towards implementation, we have found our focus on these 3 main questions: why, how, and what. Why do we have to continue this work? Why is it so important? And how can we continue to support outreach to physicians in the community and bring awareness of important Down syndrome resources? And what opportunities or connections exist? What can we do to spread this information through the medical community? And before we dive into these areas, we can look at our visions of the past, the present, and the future. Next slide, please. As Stephanie mentioned, there are many areas of concern that serve as motivation for Down Syndrome Information Acts. And the history of this law really shows the power behind the voices of self-advocates and family members. Without adults with Down syndrome sharing their stories, as well as family members and community advocates, this may have never passed into law. Countless people testified on behalf of the bill last year, talking about their personal experiences and the support and resources they did or did not receive at the time of diagnosis, and the impact that had on their family. The original proposal for the bill came from SAIL, Self-Advocates in Leadership. They recognized how critical it is for medical professionals to have well-rounded, accurate information about Down syndrome that covers medical information and concerns, as well as other outcomes for someone with Down syndrome, like Stephanie also mentioned, because we know people with Down syndrome can be leaders. They can contribute to society in countless ways, influence our community, and help to create statewide policy, which brings us to the present. We know from our past it's critical to share our stories, to talk about why and how accessing accurate and up-to-date resources is essential to a family's experience and benefits experience, and why a lack of support and resources does not benefit a family or an individual. As Deb mentioned, the Down Syndrome Information Act was passed in June last year with zero funding from legislature to support the bill. Currently, and in this webinar, we are addressing the needs in order to implement this law and make sure all affected providers and clinics have the appropriate information to provide at the time of diagnosis, as stated in the law, which brings us to our future, to tomorrow and beyond. How can we work together across the state and in our local communities to ensure this law is being followed through and that families are receiving the support they need and deserve? As we continue, I think it's important to consider how we can open our perspectives and use our tools to transform thinking, create change, and implement impact. Next slide, please. In making this bill a law, we've come to deepen our understanding about why families need to have information at the time of diagnosis. As we know, when families receive the information, if they receive the diagnosis and then are told to seek out the information, they are vulnerable to inaccurate and prejudicial information, and this does not fully engage or support this new family. We know from our past that this is a barrier that has continued to come up, and if we want to move forward, we must be willing to address these issues and let them fuel our work to create necessary change. For a family receiving a diagnosis, the language that is used and the resources provided directly from the professional will greatly impact how this family views their child and how they will utilize the resources available to them. All of these reasons were cause for self-advocates to speak out and initiate this in legislature. The first major concern I heard when hired for my position at the ARC was about appropriate medical support to new families. And like many people participating in this webinar, before the bill was brought to the table, I worked to connect with medical providers about delivering a Down syndrome diagnosis and continue to strive for outreach and awareness to medical groups across Whatcom County. Over the last year, I've presented to our local OB advisory board, to midwives of Whatcom County, and most recently to nurses at the Childbirth Center Nursery and Special Care Unit. In every presentation, there were similar reactions. Some people suggested they didn't need to know about the information, as it doesn't affect their work. Some people suggested they were very grateful for the information so they can develop their ability to be a resource. However, after the passing of the Information Act, almost all of them were unknowing about the law, which is really telling about how they're receiving this information through the medical groups and their newsletters. And when speaking with Becky Ronan from the Down syndrome community of Puget Sound, she mentioned that about 10% of practitioners that she spoke with while hosting a resource booth at the Washington State Obstetrical Association's annual meeting last December knew about the law. So we can estimate about 85% of medical practitioners in our state affected by this law are unaware of it. So with that, we can really see why it's so important to continue this work. Next slide, please. And this question, how can we continue to support outreach to physicians in the community and bring awareness of important Down syndrome resources? We would love to get your feedback and see what you guys have in your communities. But first, I'd love to just very briefly talk about what we've done in Whatcom County and hear again about your experiences. So along with those presentations I mentioned, our local community partners also help to provide several other assets for providers and families. We created a new family welcome folder, which I know other groups have in the state, that has different resources, including a welcome letter, information on Down syndrome, local support programs, and exercises that you can do with your baby, including infant massage and more. And all of our family resource coordinators in Whatcom County have copies of this folder also in all of the birth centers. It's available in English and Spanish to provide families at the time of diagnosis or referral. And also included in my presentations is a resource folder for all of the attending professionals, including those resources that Stephanie mentioned from Lettercase, Down syndrome pregnancy, and Brighter Tomorrows, as well as delivering a diagnosis information and language suggestions, and other resources as well. They were specifically designed for each group, depending on the type of care and if it's pre or postnatal. I also created a handout for them, which I'll show in just a little bit, about how to order the Understanding a Down Syndrome Diagnosis booklet, because a lot of people were unsure about that. And that could be something that we could incorporate in our state to create a handout that we can all utilize. And then also, our local partners created welcome baskets together with our local hospital, Peace Health. The hospital understood their needs to expand their supports to new families. And we had a direct connection, or a foot in the door, if you will, and they were agreeable to host these baskets and contributed to them as well. Included is some information about our community partners and our Down syndrome brochure, but also a halo sack for swaddling and some cozy fuzzy gifts like mismatched socks and bath salts for self-care. And this Monday, I had the pleasure of meeting a brand new 2-week-old family who received their diagnosis at birth, and they were full of gratitude for the support they received in the hospital, for the welcome basket and the resource folder, and just knowing this community is here for them, to walk with them every step of the way. They felt really encouraged, supported, informed, and well cared for, and it was such a beautiful, affirming moment that really helped me to gain a deeper clarity on the why and the how, about how can we continue to support outreach to physicians in the community and bring awareness of important Down syndrome resources. So let's consider some of what we know and what we don't know. Next slide, please. And I'm just going to skim through this really quickly because I know you guys have gotten a lot of information this morning. But again, just looking at what we know, that families need resources at the time of diagnosis, and they're more likely to utilize them if they're provided to them from their practitioner or they know how to access these. But again, if they're asked to seek out their information, we know that they're subject to inaccurate and prejudicial information. So we can see why having it at the time of diagnosis is critical. We also know with the average of births and the number of birthing hospitals and types of providers and clinics in our state. And so with this, I can't help but wonder, about the number of prenatal diagnoses and if that would remain the same if those hospitals and birthing centers had this information for those families. And as we move forward, consider, do you have a connection with a provider or a clinic that we might be able to get our foot in their door, so to speak? Next slide, please. And again, just thinking about the barriers that we have hit with funding and legislation, but also going to the number of booklets that have distributed through the Department of Health. It looks like we've only gotten rid of 3 from the Department of Health, but then we know from Lettercase how many booklets were ordered through them. So we can start to see that more practitioners are going to the Lettercase and Down syndrome pregnancy sites. We don't know why or who access those resources, but we do know that maybe they're getting the information about Lettercase in a more efficient manner at this time. And next slide, please. And again, I'd love more time to talk about this, but we have to get into our brainstorming sections. So again, just thinking of how we can create connections within our own communities, and knowing what's available, we're able to identify the roadblocks within our existing structure and talk about how to move forward and how you see this being useful in your community. Next slide, please. So again, coming to the question, how can we support outreach to physicians in the community and bring awareness of these resources? And I'd love to go to our question boxes and see if anybody has any feedback on maybe what's worked in your community, or how we can keep going with these resources.
So, and look, we can either look at questions individually and read through them, or we could allow people to get unmuted so that people could talk, whatever you think would be helpful. I know that there is a question about, is there any effort to reach out to family practice physicians? Sharon Darmuth had asked, family practice physicians are an additional population of care providers that we could reach out to for resource opportunities.
Absolutely. I think that's a fantastic idea. And, you know, that's an interesting thought, and I guess a roadblock that we've hit here in Whatcom County. I think, you know, one of the big concerns is making sure that people know why this information is so important for them to have in their practice and available to their patients. And that's something that we have hit as a challenge, because oftentimes we've been met by the front desk or someone who kind of doesn't quite think that our information is pertinent to their practice, even though they provide prenatal support. So I think that that's definitely an area that would be great to see how we can expand our supports in there.
Also, just to, there were a couple of comments where people were wanting to make sure that, and this is probably more towards Deb, for the resource list that she's developing, to make sure that they put information about accessing DDA services and getting information about what DDA offers, as well as the Informing Families newsletter, which is a really comprehensive website all about services provided by DDA and allied organizations around families who have family members with disabilities.
Absolutely. That is fantastic. Yeah, I totally agree with both of those things. And DDA is a critical piece that tends to sometimes get overlooked, which is really unfortunate for those new families trying to navigate this complicated system.
So this is Deb, and going back to the family physicians, I will say that on June 29th, I was just pulling up our list, we did send out an email to a newsletter article to put in their newsletter to the Washington Association of Family Physicians. But as Jessica said, you know, we don't really have much control over who reads those newsletters or who opens those emails. But I think it's a great idea to continue to reach out to family physicians. I also really love the idea of you know, not just the DDA services, but I actually was thinking, Jessica, when you were talking about the things that you include in your welcome packet, are those some things that we should be linking to as well?
Oh, yeah, absolutely. That would be great. Love that. And with any of the resources that I have, I'm more than willing to share, because we're in this together. And I think that's a really unique thing about Washington State, that we have such a great collaboration, and there's no need to reinvent the wheel. We can utilize one another's efforts.
I also noticed that Kate Orville has commented in the chat box. It says, I think that we should make sure the Washington chapter of the American Academy of Pediatrics is aware, because they might be interested in having an article in their monthly e-newsletter. And she wants to know if you have like maybe a brief article, or maybe you guys could develop one, or maybe Deb has one that could be shared with the WCAAP.
Yes.
And she volunteers to help with that.
Absolutely.
Yes, we do. and we did share one with them. But again, our plan was to do this every 6 months, so we could sort of tweak it and update it and let them know how things are progressing or not progressing, et cetera. And the reason we selected every 6 months as sort of a prod, so the push that Stephanie mentioned, is because it would be very, very, very expensive to send every healthcare practitioner a booklet. And with them not taking the initiative to ask for one, my worry would be that it would end up in the trash or it would be lost. And that would be a lot of money down the drain. On the other hand, if we send them sort of an announcement every 6 months, keep this in mind, keep this in mind, keep this in mind, we're not overburdening them to the extent that every time they see my name on an email, they just delete it. But we are giving them enough of a reminder that, in fact, they'll know where to go for resources. And that was sort of our thinking around the 6 months.
Yeah.
Vicki has asked to be unmuted and to say something, so we've unmuted her.
Great.
Vicki, are you there? Are you unmuted? I don't hear her saying anything. See if she has anything in the chat box. Maybe that's where it is. Nope, there isn't anything there. So also we have Chris Osborne says, have you considered reaching out to University of Washington or Gonzaga University's nursing or medical programs? And
oh, that's a great idea.
Requested a copy of the presentation to everybody.
Oh, that's such a great idea. Absolutely. And I also wanted to mention, to go back to the other question about sharing information, I just wrote a blog that will be posted on World Down Syndrome Day, which is on Tuesday, 3/21, and it's going to be with Within Reach. And I talk a bit about this law and the importance of it, and that could be something that we can use to share as well.
We might be able to do some tweets and put that on the DOH Facebook page too.
Oh, great. Yeah, it's something that I've noticed here in Whatcom County, and I know other people. I have spoken with Becky Ronan and the Down syndrome community, and we really find that repeating the message is key in this work. You know, again, with the email blasts every 6 months, that's going to be really helpful for that. But the more ways that we are able to repeat the message, the more effective it seems to be.
Somebody has asked about, Christy Ivan has asked if anybody has a connection to news groups that maybe people could put sort of a public interest story on the local news.
Oh, yes, that would be so great. I love that, Chrissy. I'm glad you're here.
And so also I want to point out, I posted into the chat box, this is Michelle, that we want to acknowledge that we had scheduled this from 10 to 11 and that we're past time. And so we understand that if people have other things that they need to go to, but we do have a little bit of opportunity to extend our time a little bit if people want to hang out and still have continued discussion. So I know that there's already been a couple of people who have had to leave, but for those of you that are still with us, we really appreciate your attention and interaction.
And then Mahari Wilson, I think.
And Vicki Draper says access information should make sure to go to the 0 birth to 3 programs for their families.
Yes, and I actually am a part of the ICC, the Infant and Children's Council, which has been really helpful to repeat the message to family resource coordinators and therapists in the area, and just ensuring that they have the access to the resources as well. Sometimes we have families that go to Seattle Children's Hospital and they seem to kind of fall through the cracks here, if you will. So again, repeating the message, getting it to as many people as we can.
So Mari Wilson had her hand up, and so you're unmuted, Mari, if you want to speak.
Can you hear me now?
Yes.
Yes.
Oh, good. I have a 18-year-old living with Down syndrome, and I just wanted to put out there that when Michael was born, we did not do any testing, so it was a I knew I was at risk, but it was still a surprise, I guess you'd say. But what really helped me was that the social worker at the hospital had a lot of information to give me. So that would just occur to me to be another maybe resource for new parents whose children are maybe in the NIC unit, and kind of go home empty-handed in a way, but full of information. I just felt like I had a lot of information and help from the social worker that was a resident at the hospital. So I didn't know if that was somebody that you could send information to around in the hospitals in your area.
Absolutely. That's great. Thanks so much.
I just have to mention, I am Jessica's mom, and I'm very proud of you, Jessica. And this has been a great webinar. Thank you. I'm listening. I'll be quiet now. Thanks.
Moms are wonderful, aren't they?
Aren't they the best?
So I'm also seeing that Batsheva's on the line. She commented about what about the Washington State Obstetric Association meeting in December. Batsheva, is that going to be I'm assuming it's the Washington State chapter meeting. And Jessica, is that something that you or some of the other Down syndrome organizations routinely will be a vendor at?
I have not yet done that, but I would love to be involved. I know that Becky Ronan did go to this one in December. I'm not sure if that's something that she does annually, but I would love to partner with her and see if there are other Down syndrome organizations across our state, and maybe we could have a big booth showing our great support and collaboration across the state. I love that.
Hi, can you hear me?
Go ahead.
Becky Ronan has her hand up, and so we've unmuted her. If she has a question or a comment.
Great.
Hi, can you guys hear me?
Yes.
Okay, great. It's funny because I was just requesting to raise my hand as this discussion started, because what really stood out was when I think it was Stephanie who said that the OBs really are where they're seeing in pediatricians where we need to have more outreach. And I do think that this annual conference, or it's the annual meeting of obstetricians, that's held every December in Seattle. And we have had a resource table there twice, and we do plan to do one again this year. But what I think would even be better than that, because it is wonderful to be there and people come by and get information, and it's really nice to see some people come and say, gosh, it's great you're here. Thank you for providing this information. Sometimes we don't know what to do. But to actually get inside and have a presentation during the annual meeting, they do a wide variety of topics. This year, Zika was, of course, big topic. But I think, since we have the law behind us now, I'm hoping that they would be receptive for us to, have a 30-minute, 45-minute session about the law and what their responsibility is and how to go about doing it. And so I think it'd be worthwhile to try and get on their agenda and, figure out who would make sense to go in there and, maybe a team of people to give a presentation.
Oh my gosh, I love that idea. That would be so great. And I know that Stephanie has been such a great sounding board for me in my presentations in Whatcom County. And maybe Stephanie would be able to utilize your help, because I know that's something that you've done as well, presenting at these big annual meetings.
You mean Stephanie's presented, not me, right?
Correct. Yes.
Okay, good. I'm like, well, I haven't done that. I've done a nurses meeting, but I could actually reach out. I do. So the woman who organizes it, I don't know her well, but well enough, to put a bug in her ear now in March, right? To say, hey,
Yeah.
We think that this is important and we would really like to get on the agenda for the annual meeting. And I think the sooner we start the conversation, the better. So I actually had forwarded her the information about this webinar. I'm not sure if anybody's participating, if she was able to forward the information on, but, I think we might as well start asking.
Absolutely. I think that's great. Thank you so much.
Sure. This is Stephanie, and I was going to say, Becky, you're so right on, because, there are a lot of patient advocacy groups that will do exhibits at these meetings and booths, but I noticed that there was such a huge difference when I started actually presenting at the genetic counselors meeting and the geneticist meeting. So I think the more visibility you can get, the better. And usually that comes with partnering with a medical professional who is also interested in doing that with you.
Yes, a partnership is huge. It makes a big difference.
Yeah.
Absolutely.
Hey, Jessica, we have a hand raised from Betsheva Stein, and I have unmuted her so that she can speak.
Great.
Go ahead, Betsheva. Sometimes it takes a second for people to unmute themselves.
Mm-hmm.
Well, maybe you can just move on and then she can jump in as she gets back on. Oh, wait, are you there, Betsheva? Okay, well, I guess we'll have to move on and then.
Okay. Great. I wonder if we could go to the next slide and just continuing to brainstorm about what opportunities exist in your community. And we've already kind of been going through these two questions really with our last brainstorming question, but maybe if this sparks anything new, thinking of what connections exist in your community. Again, for us, it was really critical to have that foot in the door. It really helped so much having someone in the hospital who was really able to see the importance of this work, and like Becky mentioned, having someone to present from a medical provider standpoint, someone to be on your side. So thinking in your own local community, what can you do to help build connections and spread information through your community? And we can go to feedback, or also if Betsheva was able to become unmuted, we could hear her question.
Yeah, she looks on our end like she's unmuted, but she has sent a comment that she's not been able to get the sound to work. So hopefully she can maybe type her thoughts in the comment box and I could read it for her if she's not able to get audio working.
Okay, great.
So Betsheva suggests the Washington State Obstetric Association meeting in December.
Great. Yeah, I think that will definitely be something that we can work towards. And I love that, Becky, you already have a contact there, and that we can start planting the seed right now in March. Perfect time to plant seeds.
So this is Deb, and Jessica, was so touched by the story that you shared with the family that was that felt so welcomed when they received their gift basket, et cetera. And it sort of makes me think that, wouldn't it be lovely if all 61 birthing hospitals had access to that sort of, it's welcome, if you will. And
yes.
I'm not sure how to go about doing that, if that's something that the local Down syndrome advocacy organizations want to embrace or not. But I really thought that was a cool idea, and so I throw that out there.
Yeah, thank you so much. And it really was a big collaborative effort. We heard from a question from Chrissy Iben. She started a group called Project Little Dude that was really inspired by her hospital experience, which was not positive. And she took that and let it fuel her, and brought forth this great passion and invigorating energy to be around. And with her and our local parent to parent, we together came up with the welcome basket. So I think that's great to think of as we look at these questions. What opportunities exist in your community? What is there in the partnerships that already exist, and how can we really build those? Are there social workers or family resource coordinators, other people? I know funding in this work is really sparse, and so we have to do what we can and be creative and work together, and think outside the box, I guess. So I really encourage you all to think about your connections and how we can build that, because oh my gosh, that would be the best. That's my vision, is that every family that would receive a diagnosis would get a welcome basket and have that feeling of comfort and acceptance.
Also, Jessica Kate Orville had said there's a new state clinician provider hub for all providers, and she's provided the link to it, the www.waportal.org, which is in our chat transcript that we can print out, and that this portal is interested in having more pediatric and disability resources, and she said that she's able to help with that.
Oh, that's so great. That's really wonderful. Thank you so much. I wonder if, and if people want to keep thinking about your brainstorming ideas and pop them into the comment box, that's great. But just to start wrapping up, first I wanted to show you, if you could go to the next slide, please, the handout that I created about how to order the Down syndrome diagnosis booklet and other materials. It has the letter case information on there as well. And the link to the Understanding a Down Syndrome Diagnosis booklet, the languages that it's offered in, and information about the genetics page. But this could be tailored and shifted around really about this bill, and could be something that gets sent out in the newsletter blasts, or I'm just trying to think of a resource that we can also provide so that it empowers people. They know how to order the information right away, and hopefully they'll feel empowered to do so when they receive the information on a repeated 6-month basis or so. And wanted to see what people thought about that. Also, Stephanie Meredith suggested or asked me at one point, since we know that there are a lot of people who are ordering their booklets from Lettercase, I wonder if we could have a handout like this that gets sent out to all of the Washington orders, just to make sure, again, repeating the message, making sure that they have the information about the Down Syndrome Information Act and the work that's being done in Washington State. We could also include the local and statewide resources page that the Department of Health created and will expand upon.
Stephanie, are you muted?
I am muted.
Is it possible for you to separate out or add anything to the Washington orders?
Yeah, absolutely. I can do that. So I guess what we would need to discuss offline is just what kind of demographics you would want for that, and we can definitely coordinate with that, and I can send them, because they submit their email addresses, I can send them that flyer.
Oh, great.
So Jessica, this is Michelle, and I just want to say that I think this has been a really great webinar, and people have been really engaged, and we're so excited that everybody has put out all this ideas and information, but we actually are 20 minutes past when we said that we would be done. And
sure.
I noticed that a lot of people have been leaving, and just out of respect for everybody's time, can we provide people with some mechanism for how to follow up? There is contact information on the last slide, but so that people could continue maybe thinking about ideas and maybe send them via email, so that we can give people a chance to sort of process all this information.
Great. And if people are done with that poll, we could go to the end, and just want to say thank you so much to the Department of Health for all of the work that you've done and your support in all of these efforts. It's really amazing to be able to work closely with you on this, and also for encouraging me to host this webinar and acknowledging the work that's been done by Down syndrome organizations and advocates across the state, and for providing support to this law and therefore to new families and the medical community who serves them. And this is really a nationwide effort, and we're so appreciative to have this connection with Stephanie, and so grateful that she could participate in this webinar. Stephanie, thank you again for the amazing work you do and all that you do to support people with Down syndrome, their families, and the medical community nationwide and in Washington. And thank you to all of you who participated today. Many of you have been involved in this work for many years in some form or another, and I'm so appreciative that we could all come together and set forth action to move forward and see this law through. It's invigorating to know there are so many people who are not only interested, but really trying to improve your local systems. And we really appreciate your response to the survey questions that will be sent to your email following this webinar. And again, we can follow up with email and the PowerPoint slides with our action steps to move forward with this work. And please feel free to contact us with our information on that last slide there. And we're in it to fight the good fight. So we want to be here together and just, again, thank you so much for all of the work that everybody does